How do I measure success? It's a really great question. At the end of the day, the most fulfilling thing for me is to see a patient who's beyond the initial shock, the initial scare, even the initial treatment of their cancer. It's nice to see somebody who had an oropharynx cancer, or had a bad thyroid cancer, or had a bad parotid tumor, had a complex head and neck cancer that we had to do a fibula to rebuild their jaw, something like that. It's a critical time to get them treated in a way that's going to be effective for them and meaningful for them, and kind of get them on to the next phase of life, right? To get them beyond this thing that's been disruptive for them, this thing that's scared them. And the most rewarding thing for me is just to see somebody when they're 2 to 3 to 5 years out from a bad cancer, and they're just back at life. They're just doing what they were doing before, and they feel better, and they look like themselves, and for all intents and purposes are just like how they were before, without this awful thing that really scared them. That's impactful for me. And when I get Christmas cards from patients every year, or someone comes into clinic and gives me a hug because they're just glad to see me and glad that they're doing well, or things like that, as a cancer doctor, mean a lot.